Hello, my name is Dr. Nicholas Cohen. I'm a family doctor and I'm here to share with you a top 10 list of tips for recommended screenings during pregnancy. Tip number 1, screening tests for Down syndrome and neural tube defects. The best test is called the full integrated test. It includes tests at 10 to 13 weeks and then again at 15 to 18 weeks. At 10 to 13 weeks, an ultrasound is done to check nuchal translucency, and a blood test is done for PAPPA. At weeks 15 to 18, another blood test is done. This looks for the level of alpha-fetoprotein, unconjugated estriol, HCG, and inhibin A. Tip number 2, screening tests for fetal anomalies. The best way to screen for fetal anomalies is by an ultrasound at 18 to 20 weeks. Tip number 3, screening for infection. At the first prenatal visit, the tests include gonorrhea, chlamydia, syphilis, hepatitis B, HIV. Also, tests should be done for immunity and vaccines given. Test for immunity to rubella and varicella. And testing at 35 to 37 weeks with a swab of the vagina and rectum for group B strep. Tip number 4, screening for bacteria in the urine. Screening should be done at 12 to 16 weeks. Tip number 5, screening for thalassemia and anemia. The hemoglobin should be checked at the first prenatal visit. Tip number 6, screening for Rh or D alloimmunization. This should be done at the first prenatal visit. And then if the mother is Rhd negative, the test should be repeated at 28 weeks. Tip number 7, weight checks at every visit. Weight checks at every visit should be done to screen for inappropriate weight gain, either gaining too much or gaining too little through the pregnancy. Tip number 8, screening for diabetes. A hemoglobin A1C can be checked at the first prenatal visit, and if it's normal, which is a value less than 6.5%, then a 75-gram oral glucose tolerance test should be done between 24 to 28 weeks. Tip number 9, monitoring for preeclampsia. Preeclampsia is a form of hypertension that occurs only during pregnancy, and it should be monitored for by blood pressure checks at every visit and checking the urine for protein at every visit. And tip number 10 is believe in yourself. You absolutely can have a successful pregnancy and you can stay clear of harmful effects to the fetus by following these recommended screening guidelines. I hope these tips help and have a great pregnancy. Thank you very much.